my experience, I have cared for a 90-year-old grandmother. She presented to the emergency department with acute dyspnea and altered mental status. In light of her history of congestive heart failure and patchy infiltrates noted on the chest X-ray, I started her on diuretics and intravenous antibiotics. And after initial treatment, the grandmother did not improve due to the heart failure being mostly caused by respiratory virus and intravenous antibiotics increasing sodium levels. I ordered a respiratory panel multiplex PCR and PCT test. In the multiplex PCR test, we found the grandmother actually have an influenza B virus infections. In addition, the PCT test showed a very low level of 0.12 nanogram per milliliter. As a result, I stopped prescribing intravenous antibiotics and start antiviral treatment for her. After 3 days of diuretics and antiviral treatment, the patient's symptoms greatly improved and she was discharged home. The patient was satisfied with the rapid diagnosis and rapid treatment of a viral pneumonia without the use of unnecessary antibiotics. In the past, she experienced a very similar episode when she was given on antibiotic treatment for 5 to 7 days. I definitely would like to recommend the use of multiplex PCR for patients with severe URTI, because in elderly patients with severe acute respiratory infections, it is estimated that about 10% of a severe acute respiratory infection is caused by virus infection in the elderly, but they are underdiagnosed. Furthermore, influenza or other respiratory viruses have very atypical presentation in the elderly, such as dyspnea, but without fever. Procalcitonin is a very useful tool in conjunction with the multiplex PCR. It will help you differentiate whether the patient has a cold bacterial infection or not. So with the procalcitonin test, the physicians can have more confidence to make sure the patient has pure virus infections and are more willing to de-escalate or early stop the antibiotics that is not necessary for the treatment of the patients. Taiwan has a very high burden of AMR. The emergence of a spread of antibiotic-resistant bacteria, including MRSA, VRE, macrolide or penicillin-resistant Streptococcus pneumonia, ESBL-producing E. coli and Klebsiella pneumonia, CRE and MDR Pseudomonas aeruginosa and Acinetobacter species has become a great threat to Taiwanese patients. In my experience, I have care of a 6-year-old gentleman with liver cirrhosis. He presented to the emergency department with acute respiratory failure, requiring immediate intubation and mechanical ventilations. A patient with liver cirrhosis usually have compromised immune systems and does not present with typical clinical signs of severe infections. In the absence of fever and leukocytosis, the patient was initially diagnosed as having a fluid overload and pulmonary edema because the patient had a retractive ascites. However, I ordered the pneumonia panel and the PCT test. The pneumonia panel test identified MRSA as the causative pathogen, and the procalcitonin test showed elevated levels 5.2 nanogram per milliliters. Therefore, the results suggest that the patient may have a severe bacterial pneumonia, and I started to give him vancomycin antibiotic treatment. I followed the patient. In about 48 hours, the patient's conditions was stabilized, and he was successfully extubated 3 days later and discharged to the general ward after 7 days in the hospitals. I definitely would recommend the ordering of the multiplex PCR pneumonia panel as the frontline test in patients with suspected severe LRTI infections in the ED settings. because in Asian countries, not only in Taiwan, community-acquired resistant bacteria has become a very serious problem. There have been numerous reports showing that about 25 to 30% of the patients did not receive appropriate antibiotics in the emergency department, even they have very severe infections. And we all know that time to effective antibiotics is a key factor to patient survivals. With the multiplex PCR, we can identify the microbiology etiology in the front line and give the patient the effective antibiotics in a timely fashion so that the treatment outcome will be greatly changed.